So today my title is called Tackling the Growing Opioid Crisis in Australia. My name is Camille. I'm currently an MPH student. So this is addressed to the Minister of Health, Honorable Greg Hunt. So one of the largest contributors to global disability is chronic pain. And providing effective treatment is very crucial to help minimize the impact this disability can have on individuals, society, and the economy. Unfortunately for us, we primarily rely on opioid analgesics to treat patients with this disability. Opioid is classed as a very highly addictive substance that can lead to dependency when chronically used. So worldwide, several countries, including the US and Canada, are already facing crisis, and evidence show that Australia is going on a similar path. So over the last 15 years in Australia, the rate of opioid addiction and opioid-related death has been rapidly increasing. And we see here by the green line, since the year about 2005, 2006, there has been an increase in the amount of drug-induced deaths, specifically by opioids. In addition, we also see that the hospitalization rates due to other opioids, not heroin anymore, has been increasing. In 2009, 58% of hospitalization was due to opioid or other opioid-related hospitalization. In addition, economic and cost impact that the opioid misuse is having on the economy is detrimental. So we see not only due to the increased dispensing and the increase in supply, but also the newer opioids are more expensive because they increase a more controlled release preparation. So this is a very big concern for government as the costs increase because the trends and the use of opioids are now increasing. Overall, the opioid misuse guidelines are basically regulated by the Commonwealth and state legislations. Basically, they supply the pharmaceutical drugs. Recently, changes in the regulation options have been made to take into account the misuse of strong opioids and increasing trends as of lately. So my main recommendation here is to focus on primary prevention, to increase the health professional education and awareness in opioids. So now this is a comprehensive approach to risk reduction. It includes educating physicians on the safe opioid prescribing practices, also training them on how to implement programs to bring about awareness to the patients on how to use and how to go about storing and disposing of opioids. In addition, providers can also easily be influenced by the tactics that pharmaceutical companies use to lure them in to buy their drugs and to also distribute it to their patients. So therefore, academic detailing can increase and provide awareness and education about opioids. Some ways in which we can introduce these interventional and educational interventions include implementing a screening, brief intervention referral treatment, and this basically allows physicians to be educated about the guidelines, how to manage patients that have substance abuse disorders, and also how to identify those at risk for abusing opioids. In addition, opioid treatment contracts, these have been successful in the US, and they're basically written commitments between the doctor and patient on the terms of the treatment, and the patient must comply with the rules. And they have been successful in the US. In addition, public education is important. So the collaboration of public health partners along with private health partners to use their resources to basically put awareness out there about opioids and the dangers of misusing it. This can be done through social media, radios, television, anything, any campaigning, any talks in communities, at schools, just to spread awareness to the public. Finally, policymakers and public health officials must aim to reduce the demand of prescription drugs to prevent individuals from developing the disease of addiction. Primary drug abuse prevention prevents efforts aimed to educate the patients and their families from the foundation for reducing prescription drugs. Research efforts must focus on understanding how to improve the effectiveness of the drug abuse prevention programs. That's all.